and welcome. This is Health and Wellbeing. I am Lois Abasambu. Renowned poet William Shakespeare says the eye is the window to the soul. Known as the most complex organ after the brain, the eyes are responsible for about 90% of all the information we learn throughout our lives, with visual cues such as observing, reading, thinking, and writing. But the eyes play a major role in our intellectual foundation and growth. Unfortunately, quite a number of people take the eye for granted. Today on the program, we shall be discussing glaucoma and everything we should know concerning prevention, treatment, and eye care. Our guest today is Dr. Dilichukwu Isioma Aniemeka, who is the National Advisor Inclusive Eye Health Nigeria with Christopher Blinding Mission, a non-governmental organization with a mission to support people without sight, and also supports organizations and projects on different disability intervention sectors, including hearing, orthopedic work, community-based rehabilitation, community mental health, and low vision, amongst other areas. Dr. Aniemeka, you're welcome to the program.
Thank you very much.
And it's nice having you here.
Thank you.
Well, we're going to go on a very short break, and when we return, our discussion will commence. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803 705 1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled, and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. Before we went to the break, I told you that we will be discussing glaucoma with Dr. Dilichukwu Aniemeka. Dr. Aniemeka, it's nice the job you're doing with Christopher Blinding Mission, actually helping people with sight problems and so many other things. But today we're going to be focusing on glaucoma. And when people hear about glaucoma, some people know about glaucoma, but quite a number of people do not even know what glaucoma is. So can you, in layman's terms, tell us what is glaucoma?
Okay, thank you very much. I like the fact that you use layman terms because it's very difficult to explain glaucoma in a way people will understand it. So in just very simple terms, glaucoma describes a group of eye disorders that affect the nerve that helps us to see, and that nerve is called the optic nerve. So this nerve is either directly or indirectly damaged in glaucoma. And we also know that with this damage of the nerve, there is a distinctive pattern of visual loss that is associated with it. So we know that there are so many risk factors that can actually lead to the visual loss in glaucoma. And one of the most important factors, and the one we can modify as physicians, is the pressure in the eye, known as the intraocular pressure. So this intraocular pressure is as a result of the fluid that is actually produced by the eye to maintain the structure of the eye. And when this fluid is either excessively produced or the drainage pathway of this fluid in the eye is obstructed, then there is a build-up of pressure in the eye. And then with this build-up of pressure in the eye, the damage to the optic nerve, which is the nerve that helps us to see, begins. And with that, visual loss continues. And if not checked, it can lead to blindness.
So when you say the fluid in the eye, and let's say it's underproduced, almost like the eye would, the person would have problem with moving, because I believe the fluid in the eye is what helps us to be able to move our eyeballs, yeah?
Well, not really. Not really. So when I say the fluid in the eye, it's called the aqueous humor. So it's produced in the anterior part of the eye. It also helps with clarity of vision. So when this is obstructed, what happens is that there's a buildup. It's just like having a drainage pathway that is not properly, that doesn't properly drain fluid. What happens is that there's a backlog of fluid, and when that happens, it contributes to the pressure into the eye. And when uncontrolled and sustained, it can lead to damage of that nerve.
And that's one form. Well, from quite a number of people that I've spoken to, they say it's hereditary.
Yes.
How is this? And for people that they're just born and then they say it's in our blood, we have glaucoma, generally, what causes that?
Okay, so there are some genes that have been identified that are associated to the development of glaucoma. So there are so many genes, and so these different genes can lead to the development of the different types of glaucoma. So people who have glaucoma have been known to possess those genes. And you know what genes are? Genes are passed from parents to children, and they can pass through generation. So that's why it's very important that people who have glaucoma as parents should ensure that their children are checked for glaucoma.
Now, you said something like it's a spectrum, so it means that there are different types of glaucoma.
Yes.
Can you enlighten us more on that?
Okay, so glaucoma, like I said, is a group of disorders. And then when you want to classify glaucoma, there are different ways of classifying glaucoma. So the first and most important one will be the primary glaucoma and the secondary glaucoma. So when we talk about primary glaucoma, we talk about glaucomas that you really do not see the cause of the glaucoma. So you don't know what the cause is. Unlike secondary glaucoma, which can be attributed to something. Let me take, for example, if someone has trauma to the eye and it's not properly treated or followed up, the person can eventually develop glaucoma. In that case, the glaucoma is due to the trauma, which is a secondary cause of glaucoma. But in primary glaucomas, you really do not see or really do not know what the cause is. We call it idiopathic, meaning that we don't know what the cause is.
Well, you know, most times they say when you find out the cause of a problem, it's easier to be able to treat it. So for this case now, how do you go about treating it, knowing that, okay, we don't know what caused this?
Okay. Like in my introduction, I told you that glaucoma has both direct and indirect damage to the nerve. And the only modifiable factor currently is the pressure in the eye, which is the intraocular pressure. We know that when the pressures are high, it accelerates the damage of the optic nerve, which is the nerve that helps us to see. So if we are able to control the pressure, then the acceleration is also reduced. That means that you can slow down the progression of this damage of the optic nerve head. So that is what we aim to do when we say we are managing patients with glaucoma.
Okay. So I've met quite a number of people that have glaucoma, and most especially those that are hereditary. And one of them said she went to the hospital and they said it's not mature enough or something like that. So she just has to keep managing till it gets, most especially as it relates to surgery. So she has to keep managing it. And isn't that a problem for people that have glaucoma?
I think that's probably a wrong perception. I do not think that you would go to see an eye professional who will tell you that your glaucoma is not mature. When someone has glaucoma, the person has glaucoma. It's a diagnosis that is made after examination by an eye care professional, an ophthalmologist in a clinic, and then you do a barrage of investigations that helps us to confirm this diagnosis, and after that, patient is placed on treatment. So I do not think that anyone would say glaucoma is immature. There is no maturity in glaucoma. It's
because
either
when I
there
asked, she
or
said,
not there.
because when I asked, she said, you know, she was talking about her not being able to go for surgery. So she was just given eye drops and medication to keep taking for a time before, because for her, she is like, it was said like it wasn't that serious enough for a surgery.
Okay, so that will come to the different management approaches for glaucoma.
Okay.
I think that's what I would address now. When you're talking about management of glaucoma, it starts with making a diagnosis first. So you want to be sure this is actually glaucoma that this patient has.
Yeah.
And that's why we always insist that our patients see an eye care professional to be able to make that diagnosis. And then you have to also marry what you're seeing as a doctor with what the investigations will tell you. So even though those investigations are specific, you have to tie up your findings together to actually make that diagnosis. It's not easy to tell someone you have glaucoma because to some people, it equals blindness. So you have to be sure that you're actually managing a patient for glaucoma. And then the options for management, like I said, the only risk factor that we can modify is the intraocular pressure. And every management is geared towards it, whether it be medical, with the use of eye drops and tablets, or whether it be surgical, a procedure we call a trabeculectomy, or whether it be laser treatments. All these treatments are geared towards reducing the pressure in the eye. So, for every patient, the treatment isn't the same because you look at a number of factors before you decide to treat a patient with what. So, take for example, someone who has a very advanced case and someone who has a mild case might not be given the same treatment. Someone who is older with glaucoma and someone who is younger might not be treated alike because then you're looking at factors like the age. How long is this patient going to stay on this treatment? Take, for example, if you decide to use eye drops, you want to look at the number of years this patient will stay taking these eye drops. You want to know how many of them are able to afford the eye drops because they're quite expensive. And then you want to know the eye drops they are taking, are they actually
working?
Not working, but you know we have a lot of drugs that are probably fake. So you want to know if these drugs will actually treat your patient or not. And then you want to know the compliance of the patient. So if a patient is to use drugs for a very long time, at some point they'll get tired. So these are the things you look at before you now decide to place a patient on a particular kind of management. And this is something that the patient and the doctor would need to discuss and come to an agreement so that there will be compliance and the patient adheres to the management treatment option.
There's something you said that it's not easy telling someone that you have glaucoma because for some people it's almost like you're blind. And from research I've done actually, glaucoma could actually lead to irreversible blindness. And I would think that would be what would inform people's anxiety when they're told that they have glaucoma. It's almost like, oh my God, I'm going to get blind. So if you've been diagnosed with glaucoma and we've started talking about treatment, what can the individual do to make sure that you don't get to that point where you are irreversibly blind?
Okay, so for someone who has been told that the person has glaucoma, I think a very important step in managing that patient will be counseling. Yeah. So in counseling this patient, you need to give the patient all the information the patient needs because then when you're informed, you know what to do. Take, for example, if someone is told that they have glaucoma at this point, the first feeling the person will get will be that of depression or sadness, if I put it that way. Yeah. How do you handle that? Because that will also inform the patient, inform you as a physician whether this patient is going to cope with the treatment option. And then you have to reassure the patient about the diagnosis and then the treatment options. You know, they are special in places where glaucoma treatment is actually taken from the patient's point of view. You see that they take very seriously the issue of counseling of these patients with glaucoma because it also helps them, you know, to adhere to their treatment regimen. So I would say, first of all, you counsel the patient, and then you have to have that discussion with the patient on the various treatment options available. And it's always good to let the patient to kind of choose what they feel would be best for them. And you as the doctor would now advise. So like I give you all the options and say there are medical treatments. This is the pros and the cons of medical treatment. You have the surgical treatment. These are the pros and the cons. And then you have the laser treatment. These are the pros and the cons. So you as a patient, you're making an informed decision and say, well, I think I'll go for this one and not B because this, and this. And then we'll say, okay, let us tailor your treatment towards that. and then for us to get the best outcome. So I think that would be the way to go. And then when patients are on treatment, it is always good to inform them that the glaucoma disease is a manageable disease, and what we are trying to do is to prevent blindness and not to treat glaucoma, because so many people have that notion that glaucoma is treatable. You do not treat glaucoma. You actually prevent blindness from glaucoma by treating a cause that is known, which is the raised pressure in the eye, and therefore you decrease the rate of loss of the cells that help you to see. So that would be the aim of treatment, and it should be known to the patients, so they don't have this this notion that they are going to get some magic treatment. Once I start using my eye drops, my eye will go back to how it used to be when I was a child, you know. And it's a wrong or a very painful expectation from a patient when you start using eye drops and you don't get the kind of result you think you'll have. So it's always good to prepare the minds of these patients when you're trying to treat them and say, this is what we hope to achieve with this. So they have their expectations in the right place.
Because I was going to ask, over time, would the patient get to the point where he actually does get blind? Or is it almost like an ultimate end that when you have glaucoma, even if you're treated, if you live for an amount of years, it's almost inevitable that you would get blind?
It's not a hard or fast rule. Patients are different. Some people have more aggressive diseases than the others. So it's not a one-shoe-fits-all. But we know that majority of patients with proper treatment and proper adherence to the treatment regimen and adequate follow-up, you know, with their investigations, and then also talking to their doctors and probably needing to change line of management when it comes to that. Most patients actually have useful vision for a very long time. So as long as you're able to do this, then you're able to prevent the blindness from glaucoma, which is the aim.
Yeah. Now, you said something about changing line of management.
Yeah.
And I feel that's where we can now bring, probably at a particular time, now this would be from a very layman's term because I'm lay in this, but in my thought, I would think that maybe if it's not so advanced, you can start with drugs and medication, and eye drops, and then maybe at a more advanced stage, you may have to go for surgery or for laser treatment. Is that how it works?
No, it doesn't really work like that. Like I told you, it depends on 1, the doctor managing, 2, the patient, 3, the stage of the glaucoma. That's the glaucoma. When I mean the stage of the glaucoma, I'm now looking at the damage to that nerve. Then 4, the raised pressure. And then 5, the socioeconomic status of this patient. So if I see someone who I know won't be compliant with medication because he or she cannot afford it, it will be my prerogative to advise you as a doctor. I think you should go for surgery. With successful surgeries, you may not need eye drops. You may have a longer time, you know, before you are able to maybe come back. Because also this follow-up visit.
So you constantly have to come back for more surgeries?
Yes. No, not more surgeries, but you have to follow up this patient. Because you want to know, I said it's a progressive disease.
Yes.
So glaucoma
it's almost like there's no end for it. You just have to manage it.
It's a progressive disease, and the progression is very gradual. So that's the reason why we need our patients to come back, so that we check them up and say, okay, I think you're doing well. I think your intraocular pressure is doing well. If we have done surgery on the eye, we'll say, okay, the surgery that we've done is actually okay. If it's not okay, we intervene immediately. So these are the reasons why you want to follow up your patients. We just don't ask them to come because we feel we need to see them in the hospitals. Yeah. There are always reasons for them to come back. But it's a chronic disease. So you need to follow up your patients. So depending on the stage, for more advanced disease, you may need to see them more often. For milder diseases, you may need to see them maybe once or twice a year, depending on the compliance of the patient, you know. So, and there's no telling whose disease will be aggressive and whose own would actually progress slower than the other. Yes. So we just take every patient the way we see them. We individualize treatments of our patients based on what we are seeing, you know, and then we're able to offer the best management option for the patient.
Now, the essence of all this is so that our audience actually get better informed, how to make better decisions and also adopt positive lifestyles.
Yeah.
I'd like us to talk about how one would begin to know um, first telltale signs of glaucoma. So, take for example, it's not hereditary, because for people that it's hereditary from as little as you are, they already tell you that you have this thing, we have it in our, so from little, when you start complaining of eye itches or whatever eye problems, it's almost like, okay, this is hereditary, so they know. But for people that it's not hereditary, how do you get to the point, or what are the signs you would see that would tell you, okay, you need to, this is most likely going to be this, and then you need to go for diagnosis?
Okay, so I would say this, that glaucoma is termed the silent thief of sight. So when you say silent thief of sight, it rings a bell. That means it doesn't tell you when it's coming.
Oh,
so you
scary.
really do not see anyone and say, oh, I think you have glaucoma. I keep telling my patients when I see them that the best gift you can give your child if you've been diagnosed of glaucoma is to actually tell them that this is what I have glaucoma. I think you should get your eyes checked as often as possible, so that immediately you start developing any sign that you have glaucoma, even before the visual signs, that you start getting treatment.
So,
do you understand?
I really don't get it, because I would feel that you would have to get to a certain level for you to feel that, okay, something is wrong with my eye.
Yes, I'm about to come to that. So let's take, for example, that you take the nerve that is helping us to see as one whole, or let's say 100%. Most people, before they start coming down with visual signs and symptoms, they would have lost up to 60 to 70% of 100%. That means you're left with 40 to 30%. Oh. That's what it means. And you don't know. So that's why when you look at the general risk factors of glaucoma and you feel you fall into that risk factor, the best advice I'll give that person is to get a comprehensive eye exam annually. So the signs that you may see by the time you have lost some of the nerves will be: 1, your vision starts becoming poor. So you're not able to see as well as you used to see before. The vision becomes blurred. And in some people, they're not able to see objects at their side anymore. So they're only able to see objects that are straight forward. Then some other people, when they look into light, they see colors like rainbow around the light. Some other people have very poor night vision, and that is because you don't have enough cells of the nerve to help you conduct light. So at night, when the light is poor, your vision also becomes poor. Then some of these people also, you see that I've talked about them bumping into side objects, right?
Yeah, because they can't see from
exactly. When they look at colors appear washed out. You know, so you don't get the feeling that this color is bright. You no longer see this as a bright green, you see it as a washed out green. These are things that can tell you that this might be glaucoma. Then another one is, if you look at the other type of glaucoma that causes the one that is an emergency, patients will come with painful eyes, red eyes, you know, with severe headache. They can even go as far as vomiting. Oh. Yes. And that's an emergency. Ophthalmologists will treat that as an emergency. Because if you do not, that is as a result of very raised pressures in the eye. And if you don't do anything about that pressure, it can cause accelerated damage of that nerve. So these are some of the signs and symptoms that people with glaucoma may present with.
So for this one that you call an emergency, would it be for people that actually would just say somebody hits your eye or something, or what causes that kind of?
Okay, for that one, you have to actually be predisposed to it. What I mean by predisposed to it is that the structure of your eye was actually, you were born that way. The structure of your eye is such that the drainage pathway, the natural drainage pathway of the eye is, what would I use? Obstructed, not obstructive, but it's a bit narrower than normal. So something may just trigger it, and then the drainage pathway closes all of a sudden, and then the pressure in the eye spikes. So with that, you can have such symptoms in terms.
Well, we'll talk about more of these triggers, but that will be when we come back from this short break. Do stay with us, and when we come back, our discussion will continue.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back, and thank you for staying with us. If you're just joining us, this is Health and Wellbeing, and I have been here with Dr. Dilichukwu, and we'll be talking about glaucoma, and it's been very educative. Before we went on the break, I said we're going to talk about triggers for people that are predisposed to this kind of situation. And just like you said, there's some people that are born that way, and there are things that would like trigger it, and all of a sudden it just shuts up. What are these kind of things, or what are the kind of triggers?
So first is a positive family history. We have discussed that.
Yes.
So people who are predisposed hereditary could play a role in their developing glaucoma.
Yeah.
People who are aged 40 years and older are also at risk of developing glaucoma. Then the black race
Generally.
are also predisposed. So we
We
are all
all are.
predisposed. Then aside from the black race, you also have Asians and Hispanics, but then we are talking in our own context.
Yes.
Because we are black, we are predisposed to developing glaucoma. Then people who are short-sighted, it's also a predisposing factor to developing glaucoma. Then other things, like I talked about people who probably have trauma, following trauma, someone can also develop glaucoma. Then also, the most important, it's not most important, but something I always like to discuss when I discuss glaucoma is people who indiscriminately use steroid eye drops. So take, for example, you have redness in your eye, you go to a store, and then you say, oh, I have redness in my eye, and the person in the pharmacy shop says, oh, take this eye drop, and then it's a steroid eye drop. There are so many people amongst us who respond to steroid, and in response to steroids is raised pressure in the eye. So when that happens, it can also predispose people to glaucoma. So if you have used the steroid eye drops for a very long time, it can also predispose people. Then there are also some systemic diseases that are associated with glaucoma. Things like diabetes, hypertension, migraines, and thyroid eye disease, or thyroid disease in itself, are also associated with glaucoma. So these are risk factors to developing glaucoma. Not saying that everyone who has this feature will develop glaucoma, but more like most of the people from studies who have glaucoma have these things.
Now, bringing it, like you said, all the black race is actually predisposed to getting glaucoma. What healthy lifestyles could we adopt that would actually help us in reducing or preventing this?
Okay, because genetics are involved, you know, the healthy lifestyle would be generally healthy lifestyle to combat those systemic diseases that are associated with glaucoma.
Yeah.
It's not like it stops the glaucoma, but then it can maybe prevent it from worsening if you actually check all those things. So if someone has diabetes and you're able to control your blood sugar, there's a likelihood or a chance that if you also have glaucoma, it might not contribute to the progression of this disease. So that's just how it works. So healthy lifestyle, generally for everybody, it's okay, but that's not saying that once you adopt a healthy lifestyle, then automatically you have prevented yourself from getting glaucoma. So it doesn't work that way.
So there's this other kind of eye illness, cataract.
Okay.
Yeah, what's the difference between cataract and difference and similarities between cataract and glaucoma?
Okay, so let me start with similarities. Both of them are very important causes of blindness worldwide and even in Nigeria. They cause blindness equally, not equally, but both of them cause blindness. And the age range which they affect are kind of like similar, you know. So patients who are older than 40 will probably fall within the range of people who are at risk of developing both glaucoma and cataracts. However, I would say that cataract is a cause of reversible blindness, meaning that the blindness from cataract can be reversed when you institute surgical intervention. However, the blindness from glaucoma is not reversible. So when someone is blind from glaucoma, there's nothing that can be done about it. However, you can prevent the blindness. Both of them are related to age. However, cataract causes reversible blindness, while glaucoma causes irreversible blindness.
So there's something very key in what you said earlier, and that has to do with constantly checking our eyes. And the scariest part is, like you said, in glaucoma, your eye could be damaged to about 60 to 70% before you begin to see signs that things are wrong, or you actually do have a problem with your eyes. So this week is actually the World Glaucoma Week, and there's a lot that has actually been done and is still being done. But let's talk about what Christopher Blinding Mission is doing. What is Christopher Blinding Mission doing to educate people and also help people that are already probably advanced stages of glaucoma?
Okay, so Christopher Blinding Mission, like you know, is an NGO that has passion for reducing poverty among people with disabilities. And visual impairment or blindness is a disability also. So this is a concern of ours, and it's a focus also that we do not fail to get our hands into wherever we have the opportunity to do something. For instance, this is an awareness, and I'm here on behalf of CBM, which is really important. Aside from creating awareness on platforms such as this, we also support various partners like the Federal Ministry of Health through the National Eye Health Program. We also support our partners in wherever we have our projects. We've supported some other people in the past, and in creating awareness about causes of blindness and ways we can prevent blindness from some certain eye diseases. Glaucoma Week is is a very good initiative and a platform that gives us the opportunity to interact with stakeholders and make them see the need to continue the advocacy and also to raise awareness on issues such as glaucoma. And also on our projects, one of the bane of our project is also to rehabilitate those who are irreversibly blind and also to provide low vision services for them. So on our projects, we make sure that we impute that into our activities and make sure that everybody that we see who has been affected by any form of blindness, whether from glaucoma or not, either gets some health promotion messages, gets some preventive messages. We also do curative, which is we help in providing treatments, whether medical or surgical, and then rehabilitation of these people. So these are things that we do in line with our partners, and we support them extensively to be able to do this on our projects.
Now, there's one question, and before we wrap it up, I'd like to ask, how often should one go to the hospital for checkup, most especially as 40 above predisposed, Africans as we are predisposed? How often do we need to go to the hospital for checkups? And because you said you hardly see signs till it's almost bad, how does the doctor get to know that, okay, something is wrong with you without the signs?
Okay, so there's something we call case detection. So glaucoma is not actually a screenable disease. So you do not say, oh, I'm coming to screen for glaucoma. What you do for glaucoma is case detection. Because like you said, you screen for things that you know that are there.
Yeah.
You really do not know that glaucoma is there except you actually check. So during periods like this, we encourage people to have an eye examination done, a comprehensive eye examination. Sometimes this is the only opportunity people have to actually see a doctor and get their eyes checked. So we encourage people as much as possible to have their eyes checked. That is one. Then secondly, for people who have the risk factors, especially for those who have positive family history and who are 40 years and above, it's also important for you to have at least an exam, at least once every year. At least once every year. That doesn't say you can't have two, but you should have at least one every year because you have a risk factor, especially those who have the positive family history. So, just like I would say to everyone, if your family member has glaucoma, please have your eyes checked. Parents should make sure that their children have their eyes checked. And everyone should have their eyes checked at least once every year to make sure that they catch this disease early and then treatment is instituted as early as possible to prevent blindness.
Well, thank you very much, Doctor, for taking our time to be here with us. But before we wrap it up, I'd just like you to give a word of advice to our audience out there.
Okay, so it's World Glaucoma Week, and the Glaucoma Week is actually a time where we want to create awareness on glaucoma, prevention, treatment, management, and also encourage people to have their eyes checked. So I'll encourage our viewers to please get an eye examination today with a healthcare professional, an eye expert, actually. Thank you very much.
Thank you very much, Dr. Aniemeka, for taking our time to be here with us. We sincerely appreciate your presence.
Thank you very much for having me.
What you're doing out there on the field. Thank you very much.
Thank you very much.
Well, that's the size of our package today. Do remember that by protecting your eyes, you will reduce the odds of blindness and vision loss, while also staying on top of any developing eye disease such as cataracts and glaucoma. Keep it to date with us same time next time. I am Lois Abasambo. Do stay safe.